Hello, welcome to this presentation on pediatric inflammatory multisystemic syndrome, or PIMS TS. I'm happy to do this presentation on behalf of my co-authors, Dr. Ferreira, Dr. Ramirez Mayans, Dr. Dorso, and Dr. Vasquez. What about the background? Well, several reports of a rare manifestation of severe Kawasaki-like disease, most likely associated with COVID-19, were published worldwide in pediatric patients. Afterwards, it was proposed to change the name to pediatric inflammatory multisystem syndrome, PIMS, which is temporally associated with SARS-CoV-19 CoV-2, so PIMS TS. What are the objectives to describe PIMS TS in children? Methods: an exhaustive retrospective review on pediatric patients with COVID-19 developing PIMS TS. Before PIMS TS, the concept of COVID-19 disease was mainly associated to adults with comorbidities such as hypertension, obesity, diabetes, among others. Kawasaki-like manifestations in pediatric cases were rare and mostly mild. Kawasaki disease and toxic shock syndrome are sometimes associated with Streptococcus pyogenes or Staphylococcus aureus infections. PIMS TS has presented with different clinical symptoms. Patients with PIMS TS, as in Kawasaki disease, present with non-purulent conjunctivitis, a polymorphic rash, mucosal changes, and swollen extremities. Hypotension and death from shock has also been reported in PIMS TS. However, the overlap of signs and symptoms between PIMS TS with Kawasaki disease and toxic shock syndrome makes clinical differentiation difficult. Furthermore, both Kawasaki disease and toxic shock syndrome are critical diseases as diagnostic laboratory tests remain unavailable. Levels of C-reactive protein, D-dimers, and ferritin are similar between the three entities, making it quite difficult to differentiate them. So in conclusions, although etiologic factors triggering Kawasaki disease remain unknown, respiratory viruses such as coronaviruses, adenoviruses, enteroviruses, rhinoviruses, and others have all been previously linked to Kawasaki disease. Since the management of Kawasaki disease differs from PIMS TS, it is important to make the right differential diagnosis, because misdiagnosis could lead to overtreatment and other hyperinflammatory or infectious conditions. I would like to thank you for your attention.